Today, we're going to tackle a topic that sounds pretty intimidating, but is actually way more common than you might think: the non-functional adrenal mass. We're going to break down what it is, how doctors find it, and what it all really means.
So picture this. You go in for a CT scan, maybe an MRI, for something totally unrelated. Back pain, a stomach issue, whatever. And then your doctor calls and says, hey, we found a little something on your adrenal gland. That feeling, that moment of, uh-oh, what now? That's exactly where our journey begins today.
So instead of getting bogged down in a bunch of medical jargon, we're going to walk through this step by step. Think of it as a guided tour from the moment of discovery all the way to the final decision making. The very first thing to get your head around is how these things are even found in the first place. And honestly, the vast majority are what doctors call incidentalomas. It's a perfect name, really, because they are found, well, incidentally, completely by accident. The scan wasn't looking for them, but our imaging technology is so good these days, it just stumbles upon them. Okay, the most important word on this slide is non-functional. Your adrenal glands, right? They're like little hormone factories for your body. A non-functional mass is just a growth that's, well, it's just sitting there. It's not cranking out extra hormones, it's not disrupting the assembly line, and that's exactly why most people have zero symptoms. They don't even know it's there. All right, so the next logical question is, if we found this thing, what is it? What are we actually looking at? Once it's discovered, the detective work begins, because there are a few different possibilities. And right off the bat, here is the single most reassuring fact you're going to hear. Just look at that chart. More than half the time, the vast majority of cases, these masses are something called a benign adenoma. And all that means is it's a non-cancerous growth. Simple as that. It's by far the most common outcome. Of course, there's that other category. And yeah, that can include some scarier sounding things like cancerous tumors, but it also includes much more benign stuff like simple cysts or fatty growths called lipomas. It can even be the result of an old infection or some internal bleeding. The point is, doctors look at your whole health picture to figure out what's most likely. So this brings us to the actual investigation. Finding the mass is really just the starting gun. What comes next is a very clear, methodical process to figure out exactly what's going on. It's all about turning that initial uncertainty into a clear diagnosis. And that pathway usually follows three main steps. First, they do some hormone testing with blood and urine samples. Second, they might do some more detailed scans to get a really good look at it. And third, and this is a big if, only if it's truly needed and safe, they might consider a biopsy. So why start with hormone tests? This is the absolute first checkpoint. It's all about confirming that the mass is truly non-functional. They're checking to make sure it's not secretly pumping out hormones, which could point to conditions like Cushing's syndrome or a rare tumor called a pheochromocytoma. Ruling those out is priority number one. You might be wondering, why not just do a biopsy right away? Isn't that the fastest way to get an answer? Well, this quote really gets to the heart of it. A biopsy can sometimes do more harm than good. If there's even a tiny chance it's a certain type of cancer, a biopsy could risk spreading cells. Or if it's a pheochromocytoma, poking it could cause a dangerous surge of adrenaline. So doctors are incredibly careful about this step. Okay, so let's say the tests are back, it's confirmed to be non-functional, and nothing looks immediately suspicious. The big question then becomes, what do we do now? Do we take it out, or do we just leave it alone? And believe it or not, the answer usually comes down to one single factor. So what do you think it is? What's the number one thing that helps doctors decide between surgery and just watching and waiting? It's actually surprisingly simple. It all comes down to size. For any mass that's on the small side, we're talking less than 2 centimeters, the standard approach is just observation. It's a watch and wait game. This just means you'll have some follow-up scans over the next year or two to make sure it's not growing. That's it. No immediate action needed. Now, when you get into this middle range between 2 and 4 centimeters, you're in a bit of a clinical gray zone. As long as the imaging looks benign, the plan is usually still observation. It just means everyone's going to monitor it carefully with regular scans to track any changes. And that brings us to the larger masses. Once a non-functional mass gets bigger than 4 centimeters, the conversation often shifts towards surgical removal. Now, this isn't because it's definitely something bad, it's because statistically, size is the biggest risk factor for potential issues down the road. So taking it out is often just a precaution.
All right, we have gone through the entire journey, from that initial surprise finding to the final treatment plan. So let's just boil it all down and recap the most important things to remember.
So if you only take a few things away from this, let it be these. 1. Most of these are found completely by accident. 2. The overwhelming majority are totally harmless. 3. There is a clear, logical playbook doctors follow to investigate them. 4. The decision on what to do is almost always about size. And finally, for the little ones, the best plan is usually just to keep an eye on them. And that kind of leaves us with one final bigger thought. We live in this incredible age where our technology can see things we weren't even looking for. This whole idea of the incidentaloma isn't just about the adrenal gland. It's happening all over the body. It really makes you wonder, as our tools get sharper and sharper, how is this new world of accidental knowledge changing the very practice of medicine? It's definitely something to think about. Thanks for tuning in.